Good morning. My name is Kristen Doms O'Connor. I'm the director of the Brain Injury Research Center at Mount Sinai. Across most of the United States, we're hearing a lot about the term social distancing, which is one of the most important strategies for reducing the spread of COVID-19. According to the CDC, social distancing means staying away from other people, avoiding large groups in community events, and maintaining a distance of at least 6 feet from other people. In many parts of our country, people are being asked or required to stay home and only leave the house for necessary medical appointments or to get essential things like food or medicine. This means we're not seeing our friends, most of our family, and it can be very isolating. One very important thing to keep in mind is that social distancing does not mean social disconnection. One of the most effective ways to cope during difficult times is to stay connected with other people. Social support has important benefits for physical well-being and for mental health. Engaging with other people even has benefits for cognitive functioning. So the trick is to find ways to remain connected even when we're physically separated. What people are starting to do now that they can't get together with people in person is they're planning to meet online for coffee, for a meal, or even just for conversation. They use different platforms like FaceTime, Skype, and it can be very fun and it can work very well. In our Brain Injury Research Center at Mount Sinai, we're doing research using these online platforms to deliver a group treatment program. When we first began this work, our primary goal was to allow people living all over the country to have access to specialized interventions. In order to do that, we first had to figure out if online video conferencing platforms would work well with people with brain injury. We happen to believe that with the right structure and supports, most people with brain injury living in the community can master new skills. One of my favorite quotes comes from Rosemary Garland Thompson, a bioethicist and professor at Emory University. In a piece she wrote for the New York Times, she said, "People with disabilities are the unexpected made flesh. The challenges of living in a world not built for us are occasions for resourcefulness and adaptability. We are innovators, early adopters, expert users, and technology hackers. We respond to the adversity that the built and natural environments present us." In one of our first research projects, using internet platforms to facilitate connection, we found that after learning about how to use these platforms, 95% of participants with mild to severe brain injury told us that they were able to use the technology with ease and comfort. The remaining 5% said that they needed just a bit of guidance, and not a single participant said that they required a lot of help or felt uncomfortable using these platforms. We had no idea that there would be a time when these technology skills would become such effective coping skills. So how can you stay connected? The first thing to do is to decide who you want to connect with. Who's the last person you saw and now can't get together with? Are there friends you haven't heard from in a while? Is there a friend or family member who could use a little encouragement or support? Is there someone you would like to thank for helping you with something? You might even make a list of people to reach out to so that you have several ideas handy. Now figure out how you want to connect. Using the phone is a great option, and it might be the best option if both people don't have a smartphone or a computer. FaceTime or Skype work well, and other platforms like Zoom or GoToMeeting have been very successfully used by many people. Next, think of some things you would like to talk about. It's usually a good idea to have some conversation topics in mind to help the conversation flow. Maybe you want to know about how things are going in the state or town where your friend lives, or maybe you want to tell them about something funny that happened to you the other day. You may want to just reminisce about things in the past that you've both enjoyed together. You'll want to mix in questions with your own ideas so that everyone has a chance to talk. Sometimes it can be hard to take turns and to avoid talking over each other when you're not physically present with one another. So try to slow down and just enjoy the conversation. The most important thing to remember is that everyone is doing the same thing. We can't see our friends, and we miss doing the things that we usually do every day. Everyone feels a little more lonely than usual, but we can change that. We're in this together. We look forward to hearing from you.